CliniCabin's a modular unit, purpose-built modular unit for lung function testing in the COVID era to keep the clinician and patient safe through high air change in the patient's unit and UVC light. Makes it safe for patients and clinicians when they're in and out of the unit.
There's a lot of issues with respiratory diagnosis. Things like using spirometry can be an issue, and because people are breathing out, clinicians being in the same room as patients, that's an undue risk, and a lot of people have stopped doing spirometry throughout the pandemic. So CliniCabin came to me to sort of say, this is the need. Do you think that the solution that they were proposing was the right one, which is a modular building that allows the two-way interaction with the patient, but in a safe way? And for me, innovation like this does provide that unmet need and does allow for the NHS to carry on doing what they should be doing, which is providing respiratory care for patients.
It keeps the patient and clinician separate. The clinician can remotely open the door for the patient, lets them in, they'll put PPE on to do the heights and weights, and while the procedure's happening, the clinician will go to their side, the patient will do the procedure. If there's any coughing, they're totally separate. Once they leave the room, the UVC lights come on for 5 minutes, the high air change will come on, and 6 minutes it's safe for another patient to see. So it's the follow time's down to 6 minutes, and you'll see a lot more patients going through.
Our help was, how do we make sure that it meets with the infection control guidelines? So we got advice from clinicians in the region. We undertook some tests with a local company just to make sure that actually the air change and the UV lights actually made a difference. So that's independent of the company, which is really important that you can get that advice. We've also supported them with introductions to some of the other AHSNs where there was showing some interest. So the commercial teams there, just so that they could support with any of that activity. The initial adoption we did was with North Tees and Hartlepool, and for me it's always useful to have a local company working with the local NHS, because it allows for either any adaptations or changes to be made locally, and that's always really important to kind of get that grounding with one site, and then you can sort of gather that evidence base. I now know that it's been used in Hull and in Portsmouth and in Essex, and we've been supporting with some of those discussions. I think there's always a question mark around when is the right time for the pandemic is still here, it's still contagious, and so when is the right time for respiratory services to sort of get back to normal? This solution allows them to do it now, and I think that's part of the discussion I would want to have with sort of our other AHSN colleagues, to say if they are looking for innovation in this space, CliniCabin would be part of those innovations they might want to look at.